Hello there. Welcome to Paget's Awareness Day 2025. Now, the focus of Awareness Day this year is the need for early diagnosis of Paget's to ensure that patients with the disease are picked up early, assessed, and treated appropriately. Now, today I'm joined by Dr. Stephen Tuck, who's a consultant rheumatologist at the James Cook Hospital in Middlesbrough, and who's also the clinical lead of the Paget's Disease Centre of Excellence in Middlesbrough. Welcome, Stephen.
Thank you very much indeed for inviting me and for taking an interest.
Great. So, one of the things I have heard, and I think you probably have heard as well, our information days, is the fact that many patients experience a significant delay in diagnosis. And I thought it'd be interesting for those watching the videos if you could explain the research study that you and Julie Walker did in 2021 regarding your audit of patients who had Paget's disease on X-ray in Middlesbrough but weren't actually referred. So maybe you could take us through that, Stephen. Thank you.
Yes, of course. Thank you very much. Like you, I had noticed over time that a lot of patients seem to be taking a long time to get referred to us. They often had the condition for many years before they actually got referred to it. And so I thought one of the commonest ways in which they get picked up is on X-rays, and taking the Paget's guidelines as kind of the gold standard, and they state that anyone picked up with Paget disease should be referred to a specialist opinion. I thought I could use that as a standard I'd audit against. So what I did with a group of people is we looked at 68,800 X-rays that took place over an 18-month period in a hospital, searched them for evidence of Paget disease, and of all those X-rays, we identified 43 people who had Paget's. Only 11 of those had actually been referred to secondary care, so 3/4 of them hadn't been. And this is despite the fact that many of them had X-rays going back over 10 years with Paget's disease recorded on them. And also many of them had raised alkaline phosphatase for a very long time. So the evidence had been there for quite a long time, but they hadn't been referred.
Okay, thank you. So it's a bit surprising, actually. So I presume that the radiologist who mentioned Paget's didn't recommend that the patient should be referred on. I guess not if you didn't get them. Is that correct?
Yes, that's right. The radiologist would mention the presence of Paget's disease, but because the X-ray was often done for another reason, the Paget's disease was just an incidental finding. So they kind of mentioned it somewhere in the text, but didn't say probably should be referred. So that
Okay.
just didn't happen, I guess.
Okay. Okay. So most didn't, but a proportion, I think about a quarter, you said, were referred up to the clinic. Yeah. So what happened to them?
Yes, of the 11 patients that were referred, 10 out of 11 received zoledronic acid infusions, uh, gold standard therapy. One received zedronate. Maybe they weren't suitable for zedronate, but they all got treatment. They also all had isotope bone scans to assess the extent of their illness, which is very important for knowing where complications might arise. Uh, and because they had treatment, they're all brought into biochemical remission, so they got benefit from that. Those that had pain due to active disease benefited from getting that controlled. And of course, they got assessments by myself and my colleagues, so we could look at other reasons why their pain might have persisted. 81% had osteoarthritis, for example, which wasn't going to respond to the therapy. And a number of patients needed joint replacement. And this could then be done more safely because they'd had the treatment beforehand, brought the disease under control, so it's less likely to have problems during their surgery.
Okay, thanks, Stephen. So you've got these patients out there, I guess, who are still out there, who haven't been up to the clinic. I guess you may not know what's happened to them. Would that be correct?
That's correct. We don't know what's happened to them. We did look at a whole variety of things to see whether there was any differences between those referred and those not. They had the same age approximately. They had the same level of alkaline phosphatase. Uh, they seemed to go for joint replacements about the same numbers. The same numbers had fractures. So there didn't seem to be any obvious differences. Um, but nonetheless, they weren't referred.
Yeah.
Uh,
Okay. Okay.
they,
Well, at least.
they could have had treatment in the community, I suppose. Or it may simply be that they had other problems that the clinicians looking after them thought, well, you know what, it's just not worth referring them for because they've got these other problems that are more important. I don't know.
Okay. Okay. Well, thanks for that. Well, at least a proportion did get appropriate treatment and benefited, as you've said. Stephen, it's a few years now, 4 years, I think. Has anything changed? Have you tried to encourage the radiologist to say consider referral? Has anything happened in that front?
Yeah, certainly. We presented our finding to the radiology department and asked them, when they spot Paget disease, to suggest that referral should be made. Um, I haven't reordered it, so I don't know if this has made any difference. I'd have to go back and do that. And also, the incidence of Paget disease going down over time, so it's difficult to tell from the number of referrals whether or not anything has changed.
Okay, thanks, Stephen. Well, I have to say it's a very interesting project, very worthwhile audit, and maybe it's something some of the other Paget's Disease Centre of Excellence should be doing. Certainly something we'll think about doing. So thanks for telling me your research, fascinating, and good luck moving forward with the Middlesbrough Peace Centre of Excellence. Thank you.
Thank you very much.